Let's get on to our next topic. Are you still proud of the NHS? 020 7862 2222. In a new poll, 83% of people said they feel the standard of NHS care has worsened or stayed the same in the past year. 41% expect further decline in the next 12 months. It's pretty depressing. The Health Foundation said that while there were signs of views slowly improving and most still believe that the NHS has good founding principles, public perception remains negative overall. The survey also found that over half of people do not believe the government has the right approach on the NHS, and a quarter fear it will no longer be a service for all in 5 years' time. The government pointed out it has recruited 2,000 extra GPs in the past year and delivered a £1 billion boost. So, where are we on this, Yasmin? Is it falling over?
No, it's not. I think we now live in a kind of culture where we're constantly asked about what do you think of, what did you think about the lollipop you just bought? And we've got into this sort of super critical mode, which isn't a bad thing always. But what I think is two things. The National Health Service is one of the most precious things we have. And boy, I use it a lot. A lot.
Do you?
I use it a lot. And I can tell you that it's so different this year. I get texts from my GP saying, have you had this test? Have you had this test? From a hospital where I have to go frequently for checkups, for problems. They get in touch with me.
Great.
And the survey, they don't keep you waiting. This has changed in the last year.
Well, that's good. If that's James, that gives me hope. Maybe it's not actually on the way out.
I think perhaps the binary way in which we operate, something is either broken or it's not, as opposed to there are elements of it which are utterly broken and there are elements of it which are groundbreaking, incredible, fantastic support. So do I believe in the founding principles of the NHS and feel proud of that? Yes, I think I probably do.
Do you?
Yeah, sure. I think that the idea of universal healthcare is fantastic. I think what has gone wrong is that we have, because healthcare has advanced so much and there are so many more drugs and things available, we've forgotten what should be provided for free for everybody and compared to what we want. And I think sometimes what we want and actually what some individuals can afford and various things, we need to look again at how this whole process, we can't do everything for everybody. The second thing is that the way that we organise it, I'm sorry, there is a huge amount of waste within that organisation. And you talk about these texts, I get a lot of texts from my GP. Some of them are just nonsensical, and the amount of stuff that they send you and ask you to do. And then when you actually go because you know that there's something wrong yourself and you want to get that appointment to deal with it, you can't, and people are using any in the wrong way. There's lots of things which are wrong.
Different views, yeah. And of course, we're supposed to all have an NHS dentist. How's that going? William in Renfrewshire, hi.
Good morning, Jeremy and panel.
Good morning. Well, we're all supportive of the idea that it should work and it could work, but maybe it's not working.
Sorry, Jeremy, you're going to get back in history again, but if you want to know about the National Health Service, Thatcher said that one of her biggest aims was destroy it. Farage, who's in danger of becoming Prime Minister, wants to destroy it and make it private.
Does he?
And you've already got doctors who I've only found out recently in surgeries are private, and it's contracts for the NHS.
Oh, yeah.
They also have pharmacies connected to them, a lot of them, and they get the profits from it. They've got private and national health work. They do very well. And remember, when the health service came in 48, there was two big organisations against it. It was the Doctors' Union and the insurance company. The same thing happened to Obama when he tried to bring insurances for the poor in America.
Well, what's the answer, William? Because if we all live to be 120, it will collapse. We know that. It's almost not in the NHS's interest to get us to live longer.
Well, that's another argument. But everybody knows it can be improved. But the danger is the people who want rid of it are going to make vast profits in privates. Let's not kid ourselves on. And remember, after COVID, ask how many of your viewers could get a doctor after COVID. They enjoyed the way it worked in COVID. OK,
William, thank you so much. Barry's in London. Hi, Barry.
Good morning.
Morning. Are you proud of the NHS, Barry?
I am indeed proud of the NHS. I'm not dismissing people who might have a legitimate complaint. But I think sometimes we are guilty of being a nation of complainers and moaners. We love to complain.
I think we have an excellent health service. The fact that there's even an organisation which is, in theory, doing the medical needs of 67 million people is incredible. Even that there's even something trying to do that is incredible.
Absolutely
so Barry, you're right.
incredible.
Maybe we should just recognise that.
I've never had an appointment getting, people complain about not getting an appointment. I've never had an appointment getting, a problem getting an appointment. My local doctor actually called me on a Saturday morning, said, I want to see you face to face. And he asked me to come down to his surgery near my home on Saturday morning.
All right.
So maybe I'm fortunate, but I've also had experience of treatment in the NHS. I had a heart valve replacement 5 years ago. Excellent care.
Good.
And crucially, this is where we differ from other health service. It's the aftercare as well. Well, it's two aspects. The most precious thing is being your health needs met at the point of need.
Exactly.
Without any recourse to your income or anything else.
Okay. Yeah.
So that is a precious commodity that we should cherish.
Yep. Okay, Barry, thank you. So are you proud of the NHS? And in Essex?
Hello, Jeremy.
Hello.
I am very, very proud of the NHS. I spent 8 weeks in hospital with a badly broken ankle.
Oh.
I had aftercare. They got me in touch with carers that come in. I can't say any more than well done, NHS.
How did you break your ankle?
Oh, well, I'm 70 years old. I went over on the side and I suffer with osteoarthritis.
Oh.
So,
it's horrible.
You know, it was one of those things. But I don't think we could survive without the NHS.
All right. Well, it would be interesting, that's for sure, because everyone would have to get insurance, and I think the price of treatment would go up because
Well, look at America.
Yeah.
Just look at America.
Shocking. But then again, if you've got the insurance and the money, you'll get better treatment in America than here.
Yeah, but there are people that child mortality, infant mortality is higher in some parts of America than in Bangladesh.
Yeah,
because they can't afford.
But you can always choose the poorest areas, and you can say that. But you're right. They've
got
a problem. They've got a serious. Yeah. I mean, I don't disagree.
No.
So we're talking about the NHS. Do you feel proud of it? Actually, the waiting lists have gone up the last couple of months, by the way. So they're still sorting that out. Peter in Wolverhampton, we've spoken before about your mental health problems.
Yes, I've had 25 admissions to hospital psychiatric wards, Jeremy, over 35 years.
And how would you rate the NHS? Are you proud of it?
Yeah, I think the staff are heroic because I think the patients are appalling.
So do you mind me asking, have you been sectioned then, or have you gone in yourself?
Yeah, I've been sectioned, I've been all sorts. But what I'm trying to say is that the psychiatric staff have to deal with the patients in a very obscene state. Sure. And within 2 weeks, you're back home feeling fine.
Wow. What, through drugs or therapy? Or
Well, the drugs are a support therapeutic, but it's the system is of very close control at the beginning with increasing liberal release, you know.
Yeah. Thank you. Jane in North Yorkshire, you're not so proud.
No, unfortunately not. Only proud of the nurses and doctors that apply empathy and urgency when dealing with serious matters. I've had to go private when the serious matters have occurred because I've got no joy on the NHS and only just recently last week.
Okay, forgive me, Jane. What have you needed to have done privately?
Cataract eye surgery.
Really? And they couldn't fit you in time for that?
Not as I would have liked with the lenses they provide as replacement once they've removed the cataracts. That was my choice to go private and pay for all singing, all dancing lenses. But I had an emergency occur between eye surgeries last week and this week. And I was made to jump through hoops with the 111 service to get a district nurse out, which was a reoccurring problem I was having, which I knew could be serious.
Yeah.
And even when I rang, I finally got them to give me the district nurse number, and then I was made to jump through hoops then. And it isn't when you get medical staff answering the phone, it's the people you have to deal with in between.
No, I understand. Thank you, Jane.
Medical training.
I do understand, and 111 is always a little bit controversial because of the idea that it's basically a telephone version of Google. Thank you, Jane. Very interesting views. Still a lot of faith in the NHS.